Welcome to Business Line's State of the Economy podcast, where you'll find insight, analysis, and the story behind the numbers.
Hello and welcome to the State of the Economy podcast. I'm Jyoti Datta. There's a high decibel discussion in the US on access to IVF, that's in vitro fertilization, especially so with the elections coming up in November. But closer home, though, we are seeing that in India, IVF clinics, they are mapping a healthy growth plan across the country, assisting more couples to have babies. But in a populous country like India, where does an IVF clinic, for example, fit in? And why is there a growing concern on dipping fertility rates? Another discussion that we are seeing across different countries. So, to break it all down, we have with us today Dr. Kshitij Murdia, who is co founder and chief executive officer of Indra IVF. So, thank you, Doctor, for being here with us today.
Thank you, Jyoti. A pleasure having me on this podcast and really happy to contribute in whichever way I can.
Thank you. So, IVF per se is not new, and but we are seeing this heightened activity in the segment. Whether it's multiple networks chalking out growth plans, private equities buying and selling stakes in these networks, and so on. So, could you give us an overview of this segment and why are couples, increasingly seeking out such options for assisted reproductive technologies, of which IVF is one of the tools.
So, Jyoti, as per the data, roughly 30 to 35 million people suffer from fertility issues. Only a fourth of them come forward, and eventually, when we see the IVF cycles, the penetration levels in the country is around 2%. So that's a very, very low penetration because of the deep-rooted concerns that people have that infertility is a curse or infertility is something unnatural that has happened to them. So a lot of education and awareness has been done in the last decade, but a lot needs to be done to make people understand that infertility is a disease and there's a medical solution out of it. And that's where we say there's a big role that all the IVF clinics have to play in the country. One, to increase awareness. Second, to make the treatment much more accessible and have clinics in every corner of the country because rural and the urban population both suffer from fertility issues, although the causes might be different. And also to make it much more affordable. If it is closer to them, much more affordable, they are much more aware. I think the decision making for them to walk into an infertility clinic, consult a doctor, identify issues, and then chalk out a logical management or a treatment plan would be very, very easy for these couples. Because a lot needs to be done on removing this deep-rooted concern or stigma or taboo, whichever way you call on infertility. And I think there's a lot of good thing once you solve a couple's difficulty of infertility, because we've heard there's a lot of domestic violence, there's a lot of divorces and not so good marriages, behind this fertility issues. Because all said and done, India is a country where this social desire is huge to have a child, and couples don't consider themselves complete, and especially females don't consider themselves complete unless they are able to bear a child. So I think there's a there's too much of work which is required from all, whether it is doctors or media people or private equity people, to come together, have a strong investment in terms of raising awareness, accessibility, providing affordability and good quality care across the country.
Right. So, there's one side 34 million individuals in the reproductive age that you say who have fertility issues or who face fertility issues. And on the other side, there is this concern over dipping fertility rates in India and other countries as well. So, we're restricting ourselves to India just now. You also have people who say that there are 25 million babies born every year. So, making it possibly a challenge for health, educational, and living infrastructure to keep pace with that kind of growth. So, how would you reconcile these two situations? What are we to understand here?
Yeah. See, if you see any country, and especially India, it's like a pyramid. At the base of the pyramid, you have the younger people, the middle of the pyramid is the working population, and then the top of the pyramid, the thin part, is the aging population. Now, in a country which is growing, and especially if the fertility rates are 2.1 and above, which is the replacement level, you would maintain the pyramid like that, in that fashion, where younger people at the base of the pyramid, working population is in the middle, and then the old people at the top. What you can see in various countries where the replacement levels or the total fertility has gone below the replacement levels, slowly the pyramid will take a shape of an inverted pyramid, where you have less younger people, less people in the working, and more people in the aged or the aging population. Now, that would turn the country from a population crisis to a financial crisis. You have more old people to take care of, your healthcare system gets burdened, your government would pay some incentives or monthly some amount to these aging population. So it puts the entire country into a financial crisis, and something of that sort should not happen. And that's why we are saying there's a need to make people aware about the fertility issues, support them in their journey, and make sure that they take some treatment or the other at a fertility clinic or at a gynecologist, so we maintain the pyramid in the same shape. And it's a very, very important thing, which probably other countries like Japan and Korea are suffering. India should not land up to that place.
Right, exactly. So I was just going to allude to that. You've seen China reverse its policies. You've seen Japan. You've seen other countries in Europe as well. Concerned about their fertility rates falling. So that's where this discussion fits in. But in India again, has the we do see more people talking about IVF, but has the stigma really lifted? What is it that you see in your practice? Is it being treated like any other medical disease as classified by the WHO?
I would say it has not reached to the category of a medical disease, but a lot has been achieved in the last 1 decade. I think people are now coming forward, and you see a lot of celebrities also in the country have openly talked about their fertility journey and their IVF treatment, which would help general public a lot when they want to talk about fertility issues in public. But I think it's still considered a little taboo and stigma to talk about fertility issues. So we need to normalize the conversation like any heart disease or diabetes or anything. I think that is much required in the country right now.
Right. The segment per se is also governed by the ART Act. So, what are the challenges that that face the segment? Is there a downside that you need to warn genuine couples looking, to have a baby to be careful of?
I think the introduction of ART law has strengthened the confidence that a customer or a patient would have on the IVF clinic, because now they are assured that if the government has certified a clinic, it will follow certain standards on infrastructure, on treatment, on manpower, on everything. So I think that will instill much more confidence in people choosing and going ahead with an IVF or an IUI cycle or any ART procedure for that matter. I think government has laid down very strict guidelines of what age has to be treated. You know, you can't treat a very young female less than say 21 or 23 years. You can't treat a female who's above 50 years, because naturally there are complications if you try and treat these extreme age females for fertility issues. So I think this is a very big and a good and a welcome step in the overall country's fertility journey, where we can say the confidence or the reassurance increasing, and hopefully India from a current penetration level of 2% can go to 3% or 5% like China and other developed countries.
So, a little, overview, doc, in terms of infertility per se. At one point, it was seen as a female issue or a women's issue, but that is not quite the case, is it? And just a little explanation to understand, why both partners need to be counseled when they're going in for this treatment, and
Thank you,
why we are seeing
Jyoti.
more of this as well. Sorry, why we are seeing more of this.
Yeah. Thank you, Jyoti, for bringing this very important point. And I want to convey this message to all the people listening that back in 1980s, when our chairman, Dr. Ajay Mudia, used to practice, he used to tell me now, I mean, that couples used to come, and mostly the husband would ask his wife to go forward for the investigations and treatment, thinking that males would never be responsible for fertility issues. And time and again, and now we have enough data to prove that male and female fertility issues are equally responsible. It is not that female fertility is much more than the male fertility. rather male fertility is on a very increasing trend, I would say. 40 years back, the normal semen count was easily between 60 to 120 million. Now we see semen counts ranging between 10 to 20, 30 million, and even the WHO has reduced the normal count range. So you see there's a big downward trend in the semen counts that normal males are having. And there were some reports some time back saying if this continues in the same downward trajectory, probably the sperm counts will be very low by 2050 or even beyond that. So I think it's a very important thing that as a couple you need to come forward for investigation. Infertility could be because of male or female issues. No need to feel I would say low down that as a male I am having a fertility issue and I should not go ahead for treatment. It's very easily correctable. All kinds of male issues are correctable, most of them I would say now. And it's a good thing that you evaluate the couple, make a proper holistic plan, and then discuss the treatment options with them.
Right. And then that brings us to the cost of treatment. So, what is the general, cost for a person going? Of course, it varies depending on individuals. And what sort of role does medical insurance play or not play in all of this?
Sure. The cost, I will break it down into two parts. Roughly the cost is around 1.5 to 2 lakhs, but 50% of this is the hormones, the medications that we would give for IVF treatment, and 50% is the hospital doctor fee and other consumables that we would require for the IVF process. So roughly it might take around 1.5 to 2 lakhs for a decent IVF cycle for a couple. As of now, there is no insurance from the retail insurance side, or there is no government scheme paying for these IVF cycles, which globally, if you check, a lot of insurance companies cover, and a lot of government also support in multiple, maybe 2 or 3 IVF cycles for every couple. Some corporates have started including infertility or IVF treatment as a disease or as a treatment option in the corporate insurance, which I think should come out as a retail medical health insurance, because infertility is as good a disease as hypertension or diabetes or any eye disorder. If the retail health insurance covers a cardiac event or an angioplasty or a cataract surgery or a delivery of a mother and an ICU charges, so should retail healthcare insurance should cover an IVF cycle as well, because that's a need of the hour. If 30 million plus people are suffering from fertility issues, and if we don't cater to them, and India has already gone below the replacement level of fertility 2 years back, I think we would soon get into a crisis situation, from a population crisis into a financial crisis, where we might also have the aging population.
So, doctor, are you seeing queries coming from rural India as well, or is this largely a very urban centric phenomenon? And are there queries coming from other countries even to, IVF clinics in India?
Sure. Infertility, Jyoti, as you would see, is spread across urban and rural areas, and it's not like it's an urban or a socioeconomically high ACCA segment disease. Although the causes could be different, the socioeconomic A class or the more elite people or the urban class that you say would suffer from causes of delayed marriage, stress levels, delayed childbearing intentional. Whereas the causes of infertility in a rural setup could be more around infections and DNCs and other things that is much more prevalent in the rural area. But it's spread across, and we get a lot of patients from rural areas as well. Rather, I would say we are very much present in the tier 2, tier 3 towns, and not so much heavily present in the metros or the bigger cities, I would say. As far as international patients are concerned, India gets a lot of volume from especially from Bangladesh and Nepal. They being nearby countries, and lack of good IVF facilities in these countries, India sees a lot of influx from these two countries as well. We have recently started a center in Nepal, and we are due to start another one in Bangladesh as well. And we are seeing a good uptake of these facilities in these regions as well.
Right. With that, we'll bring this discussion to a close, Doctor. From the BL team and myself, thank you so much for your time and insights.
Thank you, Jyoti. Thank you so much.